Many people considering cosmetic treatment are concerned that the final result will not look nice. It won't suit them, the teeth won't look natural, and basically they will end up with a smile that they don't like. At Advanced Dental Artistry, we've got many steps in place to ensure that the smile we give is not only beautiful but suits that patient. One of the most important aspects is we've got an on-site ceramist. Libby, who originally was in Sydney, we used to send lab work to her and models and photos and Dropbox things to try and communicate to her what I and the patient actually wanted. Now that she's here in Perth and is on site, she can actually help from the very first visit all the way through to the final porcelain. So the communication is never lost in any of the steps. We also use a system called digital smile design, and this means that we take photos of the patient and we analyze their face to ensure that the smile that we give them actually suits their entire face. And this is really important. We actually step back from the patient. We also use a lot of video because we know that when people smile, they have a certain smile or they tilt their head a certain way, and they do that because they've learned how to smile to make their smile look the best. When we use video, they can't hide from us. So we can take video from different angles and we can see whether they're gummy, maybe they hold their teeth or they hide certain areas of their teeth, and it allows us to plan better when we're actually doing our design. Once we've looked at their face, we then step a bit closer. So now we're looking at lip support. We're looking at whether their lips are in the right position and are their teeth in the right position to support their lips. And lastly, we then look at their teeth. And when we're looking at the teeth, we're looking at two aspects. One is the tooth itself, but we're also looking at the gums and how the gums actually frame the smile. We know that mathematically we can design teeth, so there's, I suppose, rules around things like the golden proportion that allows us to use maths to kind of work out the size of the teeth. You have to remember that golden proportions are really if everything was perfect. That's why it's kind of mathematical. But you have to remember that we're really looking at each individual smile and designing the smile individually for the person. So we do use golden proportions, but very, very loosely. What happens is when we've actually designed a smile, we know where the teeth are going to go, we then will take models of the patient and we'll do what we call a mock-up. We'll use that model and we'll actually apply wax to that model to the design that we have actually prepared. So Libby's job is to then look at all these design criteria and actually come up with a beautiful smile but in wax. The patient gets to see that because then they can look at the new position of the teeth, the length, and work out whether they feel that that smile will actually suit them. It's one thing seeing it on models, but it's secondly actually seeing it in your own mouth. So what we do is we then, when we do the preparation of the teeth and the visit where we're actually working on the patient, we will use that mock-up to make their trial smile. And this trial smile is critical. It'll allow the patient to actually look at that in their mouth and actually see, does this really suit me? Is the length of the teeth correct? Is the position of the teeth correct? Is the colour of the teeth correct? We can also check things like phonetics too to make sure that the speech hasn't changed. You can imagine at that point, we go back to the digital smile design. We take more photos, we analyse more, and we listen to what the patients want. If there's any changes, we make it in the trial smile, and then we will take more photos and more records to show Libby exactly those changes. It's Libby's job then to make it in porcelain, and then the patient gets to see the porcelain veneers before they go in their mouth.